Hi, hello, welcome to all for a special program, the Wellness Science. So we have a legend over here with us, a wellness expert and a founder of Soukhya Foundation, Dr. Sreekumar sir with us. Sir, welcome to our show, sir.
Thank you.
Sir, my first question is, what is wellness science?
Wellness science is not something new.
Okay.
But actually, if you really look, it is just the opposite of illness. That is wellness. So it is. So that means we all have to have the ambition to be well and keep well till your last breath.
Oh.
But today we are having a problem because even at younger days you are challenged with a lot of disease, which we are not supposed to have.
Very nice, actually.
That is why wellness science came.
Very nice, sir, actually. So really grateful to you. So, sir, exactly, the wellness science for suits whom actually? For healthy people like that?
Actually, I started wellness more than 15 years now.
Oh.
So when I started this, my concept was to prevent illness. So I wanted healthy people to come and make them strong. Very, very unfortunate to say, nobody came for that. They all came.
Because of lack of awareness? Do you think like that?
That is the first reason. Because everybody thinks that they are good. When they become sick, there's a belief that, okay, you can tide over the situation by taking some medicines or consulting a doctor.
Okay.
But this was the fact some 40, 50 years back. But not today.
Oh.
Once you visit a doctor, you are a full-time patient. Either one doctor or another doctor.
Okay.
But because there is no cure for most of the disease that we talk about today.
Sir, how useful to a healthy man?
A healthy man can improve the health.
Fine.
And that health will prevent any disease.
Okay.
Let it be anything. So you should not be scared. I have seen people who acquire health.
Fine.
They are not scared of anything. So fear factor goes away. When the fear goes, you will become more productive.
Exactly, sir. You're right.
So that is the most important thing which can happen to a healthy man. And here, again, there is a good thing. You can be productive and you can do anything in this world.
Fine.
And you can enjoy it.
Very nice, actually. Sir, actually, only for the doctors, okay, talking about the doctors, for common man. So I'm interested to join the wellness science. So it would be, we can do that?
We can do a lot of things, especially to the common man, because this awareness has to be there.
Yeah.
I will say it can be a wellness coach or a wellness educator or we can say different disease educator. Even I have designed a lot of models.
Okay.
For example, diabetic education or heart disease education, cancer education. What happens here is you are actually empowering the common man.
Oh, fine. So do you have any special courses for that wellness science?
Sure. We have courses specifically designed to doctors.
Okay.
And also to people who are scientists, maybe biotechnology, life science and all those things.
Exactly.
But apart from that, common man, we have designed a program, especially we call it maybe a certificate program, maybe 2 months, 3 months.
3 months program.
And here we call it DIY.
DIY.
Do it yourself.
Oh, fine. It's a 3 months course?
Yeah. 3 months we will be keeping the common man aware about who you are and what all things you have to do to sustain your individuality in any environment.
Super.
So that is the most important thing. So if one person, I just believe Abdul Kalam's word, if one person can be uplifted, he will uplift 9 people.
Exactly.
So 10% of population is gone above it. You have the 100%.
Super.
So that is the, because he was, when I started, wellness clinic in Kochi.
Okay.
So the same year, Abdul Kalam became the President of India. And he has given a, maybe a communication through the media that we can communicate with him.
Oh.
He is open. So I sent, because in his speech, wellness came in.
Super.
And he said if India wanted to become the number one in the world or top in the world, wellness is one factor where you have to concentrate. So I just sent a mail to him stating that I started this thing, wellness clinic and wellness solutions.
Super.
I got a reply in 6 hours.
In 6 hours?
In 6 hours.
Oh God.
Saying that,
Mm.
I'm very happy to see that somebody is doing it.
Mm.
Even though I said I have no idea what is wellness,
Okay.
keep me pasted with all the developments that you're doing. So
Fine.
we became very close, especially in communication with him.
Exactly, sir. That is
And
important.
he was motivating us, so do that, do. Even he was motivating our staff.
Wow.
So that was great because when you do have to, then he used to teach.
Sir, what is the difference between a normal hospital, normal doctor, according to that, and compared to you? You're a wellness science specialist and everything. What is the difference between
Difference is only here. We all, every individual goes for a medical checkup.
Fine.
Maybe once in a year.
Exactly.
Or something like that. But what are you assessing there? You are only going to detect a disease.
Exactly. Sir.
If there is no disease, you will say, oh, everything is okay, keep quiet, and we again come after 1 year, we will do another checkup.
Same thing.
But here what we do is, we are not bothered about disease.
Mm-hmm.
We only analyze your health.
Exactly.
And we concentrate on health but not on diseases.
Exactly.
So when you concentrate, for example, if you are coming to my clinic and say, look after, I did all the investigations and everything possible. And I will say, your health is out of 10, this is your mark.
Fine.
Then you will have a next question. I want to improve that. So I have to give suggestion for that. And that is the difference because no hospital is going to give you a suggestion to improve the health.
Exactly.
They will only give a suggestion to attack disease. So that's the difference.
Sir, how we are going to treat actually in your wellness science? Okay, patient, how you are going to treat the patient?
Actually,
in which method or which?
Actually speaking, this is one of the most scientific,
super
evidence-based healthcare.
Fine.
So I don't say medical care, but I will say this is a healthcare because I am bothered about the health of the cell because that is your basic unit.
Fine.
So any problem with you, there is a problem inside the cell. No medicines will act inside your cell.
Super.
And only thing that will act is anything that is, we call it oxygen through the air, water we drink, and food we eat. I don't have to explain what is present in all these things today. So that is why we have a very important mission here to improve the health of not only for me but also for other people.
Exactly. Yeah. Sir, actually I'm very interested to join wellness science. So can I join? How the procedure and everything? Of
course, you have our website and you can contact our resource person.
Okay.
So just put in which category you wanted. So we'll say which is the next session starts and by the time and based on that you can enroll and you can become.
So sweet actually. So when did you start the foundation actually? How long years ago actually?
Actually, Soukhya Foundation started some 12 years back.
12 years back.
But actually before that wellness started.
Wellness.
Yeah, because I put on that Soukhya Foundation because you have to educate, you have to teach, and you have to research. And in wellness, you have to treat with maybe patients come, you have to treat them, and there is no point in doing research there or education there. So I made a division saying Soukhya Foundation because it is mainly Soukhya is good health.
Super.
So that is how it has come.
So what is the result from past 12 years? What you get?
Oh. If you ask me personally and professionally, two things.
Two things, yes, definitely.
Personal thing, I am very happy.
Super. So that is very most important.
Yeah. Professionally, if you ask me, instead of asking me, I can say maybe more than 500 doctors all over the world has been educated by this. Super. And they are following it.
Excellent, sir.
And through them, I don't know how many people were benefited. So it can say a geometrical multiplication. So it is being recognized not only in India, but in Malaysia, Indonesia, in Australia, in New Zealand, in US, in UK, and in Europe. I have been to all these places to teach doctors and also to the common man, public awareness.
Super, but actually even then also, but lack of marketing or something like that. So
see, another thing that happens here is
people doesn't know about the wellness.
Yeah, this is I am doing it for my passion.
Lovely.
And for the last 16 years, I have not taken a single day off.
Super.
And every
last
day
16 years.
Yeah, every day I am working. But if you ask the next question, how can you work? Then I will say, I am not working. I am just relaxing or enjoying my days.
Enjoying your work.
So it is, people used to talk, oh, you are sacrificing your life. I will say no. And I am enjoying my life. But after so many years, I can hear one of the caption which Mother Teresa told.
What's that?
She said, people think that, okay, I have sacrificed my life for the poor and the needy. Actually, really speaking, I enjoyed my life every day. And other people looking at me is thinking that I am sacrificing. So the question asked her, how do you know it? And he said, taught by Mahatma Gandhi.
Wow, lovely, sir. Super.
So it was maybe when you do something which you enjoy, and whether you are in Mysore, tomorrow I'll be in UK, US or anywhere, or in any city, I'll be doing the same thing. Either educating the people or educating doctors, or sometimes patients come, I will treat patients. And I can say that I am treating patients even in US, UK. So, but I don't get too much of time in treating them, but I educate them, empower them.
Super. Sir, what is the final planning to reach the people from Soukhya Foundation?
So, teaching, education, research, I think it is going in a good way with the combination from the University of Mysore.
Super.
So, University of Mysore is more than 100 years old. So, it has its own credibility.
Okay.
And I think the lot of research activities and the education the university has offered to be a part of it. So, that is one of the greatest things.
Exactly.
And second thing is to reach to the common man. Actually, we have done a program some 3 years back in association with the National Human Rights Commission of India.
Okay.
So how they interacted with us is the basic human right is health. Nobody can deny it.
Exactly, sir.
So that is why they have actually put up their financial structure and motivated me. So we have covered around 200,000 population in village.
Okay.
Funded by, but only thing, National Human Rights Commission can talk only about education, educating the public. They cannot come in for treatment or healthcare activities.
Super. Sir, can you give me one tips for a common man to live happily and healthy?
So we have to understand we are living in a changing world.
Exactly.
The changes happen today in every minute. So our body has to, internal environment has to change to that environment.
Exactly, sir.
Without that, you cannot sustain your health. So the most important thing what we have to understand is your energy requirement is very high, and you have to eat more food. But the food does not come from rice or wheat or other things. You have to change your fuel, because today I know that fuel problem is everywhere, energy problem. Not only in our body but also outside. So inside our body we have to change from glucose to fat.
Oh.
Healthy fat. So the complete paradigm has to be shifted. For this, common man's awareness, and it is all, actually everything is lying with the individual, every individual. So this is actually a personalized and preventive or predictive and what all adjectives you can put, healthcare.
Super.
Based on science and...
Sir, really I'm actually very happy about it, but I have one personal question.
Right.
So what about diet? Every youngster's doing the film stars doing the diet, and what is that exactly, sir? And this is good for health?
Actually, I know that diet, when you tell the term diet, that is not a correct term. Because everybody says a lot of diets, we have seen hundreds of diets have come and gone. And today one of the most important thing, or maybe people talk about, is the keto diet. And I don't want to go into the details, but I know that you cannot take any diet just like that. But only thing here, everything is personalized. According to me, when anybody comes to me, I will look at their lifestyle, their habits, their interest.
Okay.
Then I will say, I will educate them about how the food should be, what's the combination.
Super.
Then I will give a paper to them. Now you write your diet.
Fine.
When you write your diet, if there is any problem, I can suggest.
Fine.
If I write and give, you will never follow. So I will say, make any person should be made understood how the diet should be.
Super.
And then they have to write their own diet. You will never change it.
So
it is
diet
highly
should be
personal.
like that, sir? How diet should be?
So I will say slowly shifting away from 3 times the cereals, rice, wheat, and all we used to consume.
Okay.
I think today we have to shift from that.
Mm-hmm.
So it is not easy. Only thing education and then try what to do. So convert that into fatty food and
Correct.
high protein food. So you have all the thing in this world. Because if I tell you personally, you will be finding thousands of things much better than me around you, around your house or in your village. You can get. So it is there in front of you. But only thing is that we are not seeing with the correct vision. That's all.
Exactly, sir. Sir, thank you so much. At least your complete entire you're telling about the wellness science. Really, very, very, very happy. So thanks a lot. Thank you so much.
So I have to thank you for taking pain in asking
Because I know
beautiful
you have a
questions.
busy schedule. Even then, you have to give me 20 to 25 minutes. Thanks for that.
Welcome.
So thank you so much once
You're
again.
always welcome.
Thank you, sir. Thank you so
Okay.
much. So doctor told me that no diet, nothing like that. So wellness program and wellness expert. He is a wellness expert, and moreover, actually, wellness science is the best science. Please, they have a course also. Please join and learn the wellness science about that. Thank you so much for watching. Thanks a lot.